Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about CNS depressants and deliriants. So in CNS depressants, the main drug that we are going to see is alcohol. So first we are starting with our ethanol. Ethanol, we are dealing mainly with the drunkenness examination here because this forms the major part of this CNS depressant chapter. So first, drunkenness examination, why we do is to find out the blood concentration of alcohol because there is a limit in India which is 30 milligram percentage. If it crosses the limit, then you can be booked for drunken driving. So that is the implication of this drunkenness examination. If the blood concentration goes to 80 milligram, then you can get nystagmus. Then by 150 you will lose all the muscle coordination, and if it reaches 400 there will be coma and death. So this 30 milligram percentage is very important, and for this we do drunkenness examination and we will collect samples for analysis. So in drunkenness examination, the first thing that we have to do is we have to take out the proper history. We have to rule out any disease, any condition that may mimic drunkenness, like there is concussion or any carbon monoxide poisoning or any drug intake like some CNS depressant like any barbiturate they have taken. All these, any pathological state, any encephalopathy or something that will lead to CNS depression, all those pathological states we have to rule out. Only after ruling out we can proceed for drunkenness examination. The first thing we have to note is what is the general appearance of that patient, whether he is well dressed and mannered, how he is looking, like generally how he is, like whether he is flushed or he is looking normal, he is looking agitated or looking very fatigued, how he is appearing generally, that we have to make. And then we have to look at the slurring of speech, slurring present or not. We can ask them to repeat certain words and we can find out whether slurring is there or not. After that you have to look for the eyes, whether eyes are congested or not, congestion present or not, and whether vision is clear or not. This we have to know. And we can check for memory, whether they are properly oriented, they are whether like fully oriented to the place or not, that we can check. Then we can ask them to write something, whether they are writing legible or not. So that we can ask. And we can ask about the gait, like we can ask them to walk in straight line. Then we can do Romberg test. We can ask them to close their eyes and stand like feet apart. We can ask them to do this. If they are swaying or not. If they are swaying, then they may be under the influence of alcohol. Before we have to rule out all the pathological conditions, right? So if they are swaying even after any pathological condition not present, then it is a case of drunkenness. So this Romberg test we will do. We will ask them to walk in a straight line and we will look for muscle coordination. We will do this finger nose test and we will ask them to button and unbutton the shirt. Like that we will ask to check the muscular coordination. If they have under the influence of alcohol, then this muscular coordination will be absent. Then you will look for the deep tendon reflexes. It will be dull and sluggish in case of alcohol. So this will be there, and opinion. So based upon all these, we will be also collecting sample. Like you will be collecting blood and urine for analysis, and based upon all these we will be coming to the final opinion, whether they are under the influence of the alcohol or not, we will be seeing. So what we will give opinion is that if blood test is positive and there is no muscular coordination, like you don't have any positive finding, then you will say they have consumed alcohol and not under its influence, but not under its influence. This is how you will give the opinion. If everything is negative, all are negative, then it is not consumed alcohol. This is second opinion. Then third opinion, you have both positive, blood test and all your physical examination, everything is coming as positive. Then you will say he has consumed and he is under the influence of alcohol. He is under the influence of alcohol. This is how you give opinion in case of drunkenness examination. So, alcohol, mainly drunkenness examination, you have to do all this physical examination, you have to take sample and send it for analysis. Based upon the findings, you will give opinion in ethanol. Now, we are going to see methanol. This methanol is also known as hooch because it was done in the hooch tragedy. Lot of people consume methanol and they died because of this methanol. So, this is known as hooch drug. So, what happens is that this methanol, it is a very, very poisonous drug. Whenever people consume methanol, what they will do is, there will be a latent period, and once that latent period has crossed, they will come with abdominal pain. There will be abdominal pain and vomiting, and they have this snowfield vision. Initially there will be diplopia and all, and finally they will have this snowfield vision and complete loss of vision will also happen. And serious, there will be depression of the myocardium. They will have depression of myocardium, and CNS, they will have the depression of the brain activity. So, what will happen is that there will be histotoxic anoxia. Because of that, the brain still will be completely affected by this methanol, and in kidney also there will be tubular necrosis. There will be acute kidney injury. So, basically what happens is that whenever this methanol is consumed, this methanol will become formaldehyde. This formaldehyde is highly poisonous. This formaldehyde is also converted into formic acid. More than methanol, it is this formaldehyde and formic acid that is poisonous. So, all this formaldehyde and formic acid will lead to the histotoxic anoxia and all the symptoms, and there will also be metabolic acidosis. There will also be metabolic acidosis because of this methanol ingestion. Now, the main management is you will give ethanol so that there will not be production of formaldehyde. So, this will prevent formaldehyde formation by competing with the alcohol dehydrogenase enzyme. So, you will give ethanol, or you can give 4-methylpyrrosol, which is the antidote for methanol. So, these are the main line of management, and mostly cause of death will happen because of metabolic acidosis. So, this is the main cause of death. So, the treatment here is ethanol and 4-methylpyrrosol, which is the antidote for methanol. So, this is how the methanol poisoning will happen, and in case of postmortem period, you will have very, very fluid blood, and you will have the GI congestion. All the mucosa will be congested, and kidney and liver, you can see degeneration, and in case of brain, there will be edema. There will be severe edema seen in the brain. So, methanol, hooch tragedy, it was used in hooch tragedy, and you will be seeing all the features like abdominal pain, snowfield vision, there will be metabolic acidosis, complete depression of CVS, CNS, and failure of liver and kidney. So, this is how the methanol poisoning will present, and the treatment that you can give is ethanol and 4-methylpyrrosol. Next, what we have is chloral hydrate. So, chloral hydrate, it is also known as knockout drops or Mickey-Finn. This is used in drug facilitated sexual assault. They will mix it to the drink and they will do sexual assault. So, this is implicated in drug facilitated sexual assault. Its mechanism of action, it is CNS depression. It is similar to barbiturate. So, the patient, they will lose consciousness, and this drug facilitated sexual assault, this is one of the most important drug used. Next, what we have is barbiturate. Barbiturate, this is most common drug used for suicide. And what is the mechanism of action behind this barbiturate? This will cause prolonged inhibition of this GABA and glycine. They will inhibit this inhibiting neurotransmitter GABA and glycine. Its effect, it will be prolonging. So, it is already inhibiting, and this prolonged inhibition will be further prolonged by the barbiturate, which will lead to depression of the brain activity. It will mainly affect the reticular formation, which will lead to lot of dullness. So, this is the mechanism of action behind barbiturate. And this barbiturate, what you mainly get is respiratory failure. The cause of death you will be getting is respiratory failure and all the signs of asphyxia. You will be getting all the signs of asphyxia, and sometimes you will be getting barbiturate blisters. So, this is about barbiturate. So, in CNS depressant, we have seen ethanol, methanol, chloral hydrate and barbiturate. So, now what we are going to see is CNS deliriants. So, these will cause CNS stimulation, this will cause delirium. So, first we are going to see is cocaine, and this is prepared from this plant Erythoxylum coca. So, this is the cocaine plant, and from this you will be getting cocaine. So, cocaine, what it will do is, it will inhibit the reuptake of biogenic amines, like all your stimulatory pleasure causing amines like your serotonin, it will not be reuptaken. So, it will inhibit that reuptake. Because of that, there will be excitation. This excitation will keep on going. That is why it will lead to delirium. So, this cocaine, it will inhibit the reuptake of biogenic amine, and all routes of absorption like inhalation, ingestion, all route of absorption is there, and it is very, very fast acting. Generally, it is inhaled. They will do the cocaine via the inhalation route. And what are the features that you can see in case of a cocaine addict? That will be crack dance, that is chorea, and tremors, crack lung. Because of this constant inhalation of this cocaine, there will be pulmonary hemorrhage. This cocaine, it has these vasospastic activity and hemorrhagic tendency. This is the main action of this cocaine. So, everywhere it will lead to vasospasm and hemorrhage. So, in lung you can get diffuse pulmonary hemorrhage, and crack eye is due to corneal abrasion and scar formation. So, what will happen when they are trying to snort, when they are trying to inhale the cocaine, some of the cocaine will deposit in the eyes over the cornea. This cocaine, it will lead to anesthesia because of this vasospastic activity. So, there will be repeated rubbing of this cornea. Because of that, corneal abrasion will happen, and this abrasion can end up with corneal scar formation, which can result in loss of vision. So, this is crack eye, and crack baby is baby born to addict. It is a baby born to a cocaine addict, and this baby, it is more prone for SIDS. Sudden infant death syndrome, it is mostly seen in these cocaine addict babies. Now, what is cocainophagia? This is chronic addiction to cocaine. This is known as cocainophagia. And in cocainophagia, you will be getting palate perforation, septal perforation in nose, and you will also get black color teeth. You will get tactile hallucination. tactile hallucination, which is known as Magnan's bugs. Like there will be feeling of bugs crawling under their skin. This is Magnan's bugs, also known as formication. And the medico-legal importance of this cocaine is that like it is consumed along with heroin and it can go overdose. So, cocaine plus heroin, it is known as speedball. For excitatory stimulation, they consume that and people may end up dying because of overdose. And Brompton's cocktail, it consists of cocaine, morphine, alcohol and chlorpromazine, and it is used to reduce pain. So, this is the medico-legal significance of cocaine. So, mainly we have to remember the mechanism of action and the plant from which cocaine is attained, that is Erythoxylum coca, and what are the cocainophagia symptoms. You will have the palatal and septal perforation, black teeth, you will have pulmonary hemorrhage, where like all over the body you will have a hemorrhage, like your heart will suffer from infarction, there will be acute coronary syndrome because of this vasoconstriction. So, all the things will be seen in this cocaine poisoning. Next, what we are seeing is cannabis. So, cannabis, it is also known as Indian hemp, pot, dope or grass. This cannabis, it has active principle known as cannabinol, which is tetrahydroxycannabinol. So, you have this tetrahydroxycannabinol. Tetrahydroxycannabinol. So, this will go activate all the cannabinoid receptor in our body, which will lead to CNS stimulation and delirium. So, this is the mechanism of action behind this cannabis. And this cannabis, it is usually seen in multiple forms. First is Bhang. It is a drink that is made out of this cannabis and it has 15% of THC concentration. And Majoon is sweet prepared from this Bhang. So, these are usually consumed during few festivities. So, these are Bhang and Majoon. Next is Ganja. This is the dried powder, which is the dried leaves, it will become powderized and you will use. This Ganja is very popular and they have 15 to 25% of tetrahydroxycannabinol. Then you have charas, which is basically resin of the leaves. The resin that you get from the plant, it is known as charas, and they make something known as hash oil out of this charas, that is having the highest THC concentration. So, this charash is also known as hashish and they make oil from this hashish, which is known as hash oil, and this has the highest THC concentration. And we have something known as sinsemilla, which is we will make female plant without seeds. So, this will increase the tetrahydroxycannabinol yield. So, this female plant without seed is known as sinsemilla. To increase the yield, they will do this plantation. This is about cannabis toxicity, and when there is chronic addiction to this cannabis, there will be lung disease, there will be diffuse lung disease because of this constant inhalation, and there will also be myocardial infarction and degeneration of neuron. As it keeps on going, there will be complete degeneration of neuron, and finally the patient will end up with psychosis. So, in psychosis, they will do one thing known as run amok. So, what they will do is, they will become psychotic and they will go on a killing spree. So, they will start killing everyone they are coming across. This is known as run amok. And there is something known as amotivational syndrome. What here happens is that there will be complete burnout. There will be complete burnout and apathy. They will not be excited by anything. They will not feel anything. So, they will be simply sitting like a statue. So, this is amotivational syndrome. And something known as Koro. This is mainly a psychological symptom where they think their penis has shrunken. So, all these manifestations are seen with cannabis, and when it is chronically taken, there will be complete psychosis and degeneration of neurons. So cannabis, the main thing you have to know is what is the active principle and what are the forms of cannabis and these Coro, run amok and A motivational syndrome. These are important in cannabis. Next what we have is Dhatura. Dhatura is most important deliriant poisoning, and in Dhatura all parts are poisonous, and the active principle in Dhatura is atropine. Active principle is atropine, so it will lead to symptoms that is completely opposite to OPC poisoning. So in OPC you had all the secretions increased, right? Here in this Dhatura you will have everything drying up. So Dhatura, D for Dhatura and drying up and delirium. So you have certain features that can be seen in Dhatura. We call it as D's of Dhatura. So what are those is? There will be decreased muscular coordination, there will be delirium, delusion, dermatitis, dilated pupil, dreadful hallucination, drowsiness, drunken height, dry hot skin, dry mouth, dysphagia and dysuria. Finally, death by respiratory depression. There will be finally death by respiratory depression. So these are the D's of Dhatura. Here you will be getting to see this dry hot skin. Their skin will be very, very hot. They will say dry as a beet and mad as a, there will be like delirium. So because of that they will be say mad, and this because of this dry hot skin they will be having post-mortem caloricity. So these are the D's of Dhatura. And what is the antidote for Dhatura? That is physostigmine. This physostigmine, it is the first line because it can cross blood-brain barrier. Apart from that, you have neostigmine also, but the main mode of treatment here is physostigmine. So Dhatura, it is a deliriant, all the parts are poisonous, and the active principle here is atropine, and you will be getting to see lot of D's in Dhatura. Mainly you have delirium, dry skin and death by respiratory depression, and every membrane, every secretion will dry up because of atropine, and the antidote here is physostigmine. So deliriant we have seen the cocaine, cannabis and Dhatura, and CNS depressant we have seen ethanol, methanol, chloral hydrate and barbiturate. So with this we are concluding this video. Thank you for watching.